This is the time I get to spend with you guys and go over all your questions. But today, we got a special hump day because today it is show and tell. That's right, because we're very excited. We have a new device here at Pure Plastic Surgery, and we're super excited about it because it's going to help make your liposuctions better and with less blood loss and less bruising, and it's going to create that beautiful, beautiful definition for you. So what are we talking about here? We are talking about the VASER. It's a VASER with a V, okay? Not a laser, a VASER, all right? So that's the name of the device, and we finally got it here at Pure Plastic Surgery, and soon here I'm going to show you the actual device and how it works. But before we get to do that, I just want to talk about it a little bit, explain, the type of energy that it uses, what are the advantages, and how that's going to give you that beautiful defined HD lipo that we're looking for here at that total definer look that we have here at Pure Plastic Surgery now. Okay, so what does VASER actually stand for, right? So like I mentioned there, it's important that you know that it is a V, not an L, so it's not a laser. And what it stands for is vibration, amplification of sound energy at resonance, okay? But the key thing here is that the type of energy it uses is sound energy or ultrasound type energy, okay? But it's using energy, so it's different, say for example, than the ultrasound that we use for imaging, all right? The ultrasound that we use for imaging is the one that we use when we do the fat transfer to make sure that we're in that right space, okay? And that, provides an image where I can see the different layers and I know exactly where I'm going, but it doesn't impart any sort of energy whatsoever. It doesn't impart any sort of heat, all right? This is completely different. Now we're using concentrated sound energy to provide heat, okay? And the advantage of that is that it uses this energy to essentially separate and dislodge the fat cells in a way where it does not affect the arteries and veins and nerves, okay? So specifically for the fat cells there. So it uses the energy to kind of shake them up and dislodge them, and then that makes it easier to remove the fat, okay? With less blood loss because you're not working so hard, and you can remove more fat, and you can remove also that fat that's really hard to get to, that's kind of in that superficial layer just beneath the skin, which is a great advantage for when we do HD or high definition type of lipo, okay? So it uses that ultrasound energy, it separates and dislodges the fat comes out cleaner, basically less bloody, okay? We get more fat, all right, and there's less blood loss. So I'll show you just a little example here. So when you have, if you can see that, how is the screen? Can we see that on the screen there?
Let's go here first.
Here first, okay.
Yes, and here.
So here is what it looks like when we typically remove fat without a VASER. You see the fat on top, and you see kind of the bloody tumescent fluid at the bottom there, right? But with using the VASER, the fat should look a lot more like this, where you're taking out a higher volume of very clean, very golden looking, yellow gold type of fat with very little blood loss, okay? And that's one of the main advantages of the VASER here, all right? And we'll show you here kind of exactly what it's doing. So in a cartoonish type of way, if you guys can kind of see that there, of course, the first step, what you should know is that it adds an extra step to your liposuction procedure, right? So typical liposuction, you're adding the tumescent fluid and then you're doing the suction, all right? Here, you're still adding the tumescent fluid. That's a very important part, okay? But then you're using the VASER to impart that vibration, that ultrasound type energy to shake up and loosen up the fat cells. The other thing is that now the fat comes out in this nice creamy fat, this beautiful creamy fat, not in like these big chunks that we sometimes get with your regular power assisted liposuction, okay? So you get this beautiful, nice creamy fat, and then of course you suction it out, so then you do the liposuction. We still use the micro-air for that, which is the power assisted liposuction, all right? And then after that, because there's less trauma with the use of the VASER, okay, we have, and there's also a little bit of heat being imparted, we have better skin retraction. Okay, so it improves the skin retraction. So it's a key component of that total definer high definition package, which is why we've added it now here at Pure Plastic Surgery, because as you know, we're going to be doing that total definer package where we're doing that really kind of defined high definition lipo for both men and women. So men, guys, pay attention, because this is for you too. You ever wanted to have a six-pack? Well, now's the time. Come to Pure Plastic Surgery. We got everything that we need to create that beautiful six-pack for you. Okay? All right, so what does the machine actually look like? So here is the wand, and you know, if you're just kind of looking at it, and oh, here, check it out, guys. VASER, that's right. Yeah.
Oh.
Cool. All right. It's like another lightsaber if all the Star Wars fans are here, right? So it's like a lightsaber, but instead of light, it uses ultrasound energy. All right, and you know, for the untrained eye, it looks just like it would like a liposuction cannula. Okay, but there's a big difference, right? There's no hole in it. See, I don't know if you can see the tip of it, but it's not a cannula. It's not for suction. It's the wand that actually produces the energy. Okay, and here's the actual machine. I don't know if we can see that, but it's just, you know, the machine itself is just a box, and you can either crank up or lower the energy there, and it has like two modes, a VASER mode and a continuous mode. The VASER mode is what we typically use. For most patients, we're going to be using somewhere around 70% energy, because we want to have enough energy for it to work, but not so much energy that it's going to ruin the viability of the fat cells. Okay, so that's been a key component here, because before I was kind of against the VASER, because in the earlier editions of this machine, the energy levels were too high, and so they were not just dislodging the fat cells, so they were bursting the fat cells, right? And if you burst the fat cell, then you can't use that for fat transfer. And that's why for so many years I haven't got the VASER. But now we have this latest generation machine. We can really kind of dial down specifically to where we want to be. If you're somewhere between 60 and 70%, that is ideal, because you have enough energy to loosen up the fat cells, enough energy to create the skin retraction, but not so much energy that you're going to burst the fat cells. So it's kind of right there, like the Goldilocks, right? Just enough energy. And now here we go for a demonstration. Check it out. You're gonna both be able to hear and see what's going on here. All right. So this is just water. All right, right in here, and check this out. You hear that noise?
Oh.
And look at that. Look how it's moving the water, bubbling that water around in there.
Yeah, looks great.
Yeah, you see that? You guys able to see that right in there?
Yep.
Perfect. And check that noise. Ooh. All right. Awesome. So that's how it works. Okay. And like I said here, and let me leave that right there. As you can see here, the advantages are going to be, there's going to be decreased bruising and less blood loss. There's going to be an increase in skin retraction. All right, and it actually helps us a lot for those areas that are notoriously very fibrous. So for example, in a gynecomastia case, all right, again, for the men, right, if you have excessive kind of breast tissue, all right, a lot of times before we had a machine like this, we would have to go in and actually make an incision and physically cut out or remove the tissue. But now with the VASER, okay, it's able to break up a lot of that fibrous tissue to the point that we can then remove it or suck it out with a cannula. So it's going to be a lot smaller incisions, little tiny stab incisions, a lot less pain, a lot easier recovery with some good skin retraction. It's a great, great tool for all you guys out there. If you have any sort of gynecomastia that you want to get fixed, all right, we have this available here now. All right. And what are other fibrous areas? Well, people that come back for, say, a round 2, right? Sometimes a round 2 can be very, very tough because of all the prior scar tissue and fibrosis from the first round, okay? And also, so they tend to be very tough on the surgeon, but also they tend to be a lot more bloody. Well, now with the VASER, we can add this extra step, go in with the VASER first. That's gonna help soften up, okay, and break up that fibrous tissue, which will then make the liposuction aspect of it a lot easier and a lot less bloody for the patients, okay? So a lot of great advantages. We're really looking forward to using this technology. It's available now, all right? So if you're looking for the VASER, just give us a call here at Pure, but I'm happy to answer any questions that you may have.
Okay. Okay. Super informative, Doug. You're awesome. That's a message.
Thank you.
And the first question, it's regarding this topic. Can you do it to a patient with diastasis?
So you can use the VASER with someone that has a diastasis, and but it's not going to fix the diastasis, right? So the VASER helps with fat extraction, okay, and skin retraction. So fat extraction and skin retraction. But it's not going to tighten up muscles, and it's not going to close down a diastasis. So for that, you're still going to need your tummy tuck. But what we can do is combine it with other modalities, right? So now, say you have a moderate amount of loose skin, you don't have a diastasis, okay, maybe for that patient we can do the VASER plus the body tight, and that'll give us enough skin retraction to hopefully avoid a tummy tuck.
Okay, are you able to contour hip dips?
Yeah, so definitely. So the good news with the VASER is that we can now use that in combination with fat transfer, because the fat cells are now going to be viable, all right? So that means we can use them, they're going to survive. So we can do VASER HD liposuction and then use that fat to fill in your hip dips and create that beautiful, Earl curve from the front, signature upside down heart shape from the back with a nicer HD lipo as well.
Does it replace a tummy tuck?
So I'm not going to say it's going to replace a tummy tuck, okay? Again, if you have severe skin laxity, meaning that you have very excessive loose skin from say one or multiple pregnancies or massive weight loss, it's not going to replace that, okay? Also, if you have muscle weakness or separation, it's not going to affect that, okay? But it is going to help with the definition if you're an HD lipo candidate. And it is going to help, with skin retraction if you're like in the more like the mild to moderate skin laxity stage.
This question says, why don't you offer fat transfer to the lips?
Oh, to the lips. Okay,
Yes.
Good question. So I personally don't. That doesn't mean that it's not offered in plastic surgery. There's other surgeons out there that do that. I think that once you transfer the fat to the lips, that's it. It's permanent. It's there forever, okay? And as you know, as times change, looks change, as people get older, you may not want that super big plump lip, when you're 70, all right? But then it's, if you put fat in there, that's it. Same way that with the fat that we put in the hips and the buttock, like once it takes forever. Once it takes in the lips, it will take forever, okay? I just don't think it's a great solution. Sometimes also you can, it can scar down, form little balls of fat necrosis and things like that, and it's not reversible. Now, when you use a filler, okay, the hyaluronic acid fillers such as Restylane and all the other hyaluronic acid fillers out there, yeah, I understand it's not permanent, but it lasts a good 6 to 8 months. And if there's ever an issue, it's reversible, right? I don't know if you guys know this, but there's a injection called hyaluronidase, which breaks up the filler. So if, say, for whatever reason, it got too big, or one side became a little bit lumpy, or whatever, and you needed to reverse it, there's a reversal agent. Whereas with fat, there's no such thing.
Look, this is from a colleague. It says, hello, I'm Dr. Chenoufi from Tunisia.
Ooh, Tunisia, wow, all right, how you doing?
I used VASER 6 months ago.
Okay.
The skin retraction is amazing. The
All right.
definition is better, but I have a question for you.
Okay.
Do you combine VASER safely with J plasma or body tight?
Right, so that's a great question, and thank you for joining all the way from Tunisia. That's great. So yes, we can combine the VASER, at least certainly with the body tight. Now I personally have not used it in combination with the J plasma, but I have used it in combination with the body type, and it works well, and that combination really helps even more skin retraction, okay? Now, of course, when you're doing all this, you have to be careful, right? Your liposuction cannot be overly aggressive, all right? Because we have to preserve that blood supply to the skin to make sure that the skin does okay, prevent any potential side effects or issues such as skin necrosis or things of that nature, okay? So you always want to leave a little bit of fat underneath the skin. You never want to thin it out so much that you're going to have what some people call like a lipo burn, which is basically skin ischemia in that area.
Can you talk about the antibiotic and infections caused by BBLs?
Right, so, well, infections are not caused by BBLs, all right? They're caused by bacteria, really. But yeah, is it possible to get an infection after BBL? Of course it is, after any surgery. The only way to have a 0% infection rate is to not do surgery at all right? So what are the causes of infections? So they're bacteria that are typically on us, right? We harbor bacteria on our skin, inside our nares, in our bodies, obviously, and of course around the anal region, which is where we're doing the fat grafting for the BBL. So that's why we have to be very, very careful, and we want to try to do everything that we can to minimize that risk to get it as low as possible, all right? So we do several things here at Pure Plastic Surgery to minimize that risk. One is, yes, we give you antibiotics in your IV before and during surgery, and then we give you oral antibiotics for 1 week after surgery, okay? We also place antibiotics, we mix it with the fat before we then transfer the fat into the buttock and hip region, okay? Right before the fat transfer, so after we're done with the liposuction, but before the fat transfer, we re-prep and drape the patient, okay? We cover the anal region with a gauze, basically, that's soaked in betadine, okay? And also prior to starting the procedure, we have UV lights that basically kill off all bacteria and viruses in the OR before starting the procedure. So we go through several steps to minimize that infection rate, and I'm proud to say that here at Pure Plastic Surgery, we have one of the lowest BBL infection rates in the entire nation at less than 2%, which is quite incredible. But it's because we take all of these extra steps to minimize that infection rate as much as possible.
What type of test labs are needed to be complete for medical clearance?
Great, so in order to have surgery, you're gonna have to go through a whole medical clearance type process, which involves labs. You're gonna need a lab to check your hemo levels, and that lab is called a CBC, complete blood count, okay? You're gonna need a lab to check your electrolytes, and that's called a basic or complete metabolic panel, okay? You're gonna need also to check how well your blood clots. So that one's called, there's two of them, it's called the PT and the PTT, okay? You're gonna need a blood test to make sure that there's no pregnancy. And we do always check everyone for HIV as well. All right, but don't worry, once you kind of sign up for surgery, you're gonna get a call from our pre-op department somewhere around 45 days before the surgery, and they're gonna go through everything in very, very specific detail, and they're gonna give you a list of all the specific labs that we need in order to get you cleared, okay? There may be additional labs if you have other comorbidities going on. For example, say you have hypothyroidism, all right, and you're on Synthroid. Well, then we're also gonna be checking a thyroid panel to make sure all those thyroid levels are okay before surgery.
Okay, Doc, will you be replacing traditional lipo with VASER?
Well, yeah, that's definitely the way that we're heading, because I think there's many advantages to it. It is an extra step though, so it does take some additional time, which then, of course, additional time means additional cost, right? But that's it. But yeah, we're definitely offering the VASER. We're offering to anyone that's getting their BBL, their Lipo 360, okay? And of course, their Total Definer HD package. Actually, the VASER is automatically included in the Total Definer HD package because that package includes everything. That package includes HD Lipo to pretty much not just the trunk, but anywhere that it's needed in the body. Okay, so that includes arms and chin, all right, potentially thighs as well. It includes the VASER, it includes the body tight, it potentially includes Morpheus as well. So that package includes everything that you need to get that beautiful athletic body that you've always wanted.
Are your patients discharged same day of surgery, or are they patient placed in a post-op like setting in your facility?
So everyone that has surgery at Pure Plastic Surgery is going to be discharged the same day. We are designated as what's called office-based surgery, okay, which means no one stays here overnight. That's why we go through such a rigorous process before surgery to make sure that you're healthy, and you're able to withstand the surgeries and able to go home, okay? So what happens is that after surgery, then you go to our recovery room. You're gonna be in a recovery room for at least an hour minimum, okay? It may be a little bit longer, but yes, eventually we will call your caregiver to come pick you up, okay? And then from there, you can go to, several options. Say if you're from Miami, you can go back to your home. If you're coming from out of town, to a recovery house, or you can go to a hotel. Now, you do have the options, but we recommend that you go to the hotel, which is our partner, which is the AC Hotel here at Dadeland. So we are partnered with the hotel. They know everything about our patients. They know how to take care of them. They know what to expect. All right, so that is our highest recommendation, is to go to that hotel.
Can you fix a scar from previous tongue tuck?
Yeah, so we can do a scar revision. It really all depends on how extensive it is, what we need to do. But yeah, definitely, it should be something that we can improve. Of course, I would take this on a case-by-case basis. So my recommendation would be that you send your questionnaire, you send your photos, you let us know what it is exactly that you don't like, so that we can create a operative plan specifically and uniquely for you.
Okay, Todd, YouTube is burning in questions too.
What?
So,
all right,
yeah.
you too.
Yeah.
No, excellent.
I recently had a brachioplasty, but I'm happy because my arms are a little bit bulky.
Okay.
My surgeon did not include liposuction. Would you recommend lipo or VASER for a second round?
Yes, so that's definitely a possibility. So if your arms ended up still a little bit bulky, okay, but the skin is doing okay, so not too loose because you've had your brachioplasty, then actually this would probably be a good solution for you. So you can do a VASER Lipo, potentially even add body tight to that. So you can do VASER Lipo plus body tight, and that should help your skin retract more, but also reduce the bulk with the liposuction aspect of it as well.
Nice question. What's the difference between body tight and liposuction?
So they're two different things, right? So liposuction is the actual act of using a cannula and suction to remove the fat, right? And the body tight is a device that imparts energy. Now this time it's called radio frequency energy, okay? So you do body tight in addition to liposuction. Liposuction helps with removing fat. Body tight helps with helping the skin tighten, okay? Skin retraction. All right, and the VASER helps with both, okay? Because the VASER helps loosen up the fat and break it up into like the little tiny, that smooth, creamy fat. So it makes the liposuction afterwards easier, and we can remove more fat, okay? And it helps the skin retract because it also helps impart some energy to the skin and allows the skin to retract. So the VASER can help with both. But it's an additional step, once again. So you're doing your tumescent, then you're doing the VASER, then you're doing your liposuction.
Okay. Can you get the hips filled without getting a BBL? So a hip BL?
So, yeah. It depends exactly what you're asking. So one way that I see your question is, can you do fat transfer only to the hips and not to the buttock?
I think that's the question.
Definitely yes, you can definitely do that. Now, can you fill in hip dips without having liposuction at all, using something other than fat? So there is something that you can use that's called Sculptra, but Sculptra does not work for like deep hip dips. It doesn't work for large areas. It only works for like very small areas for a little bit more of a subtle change, And if you're using several, syringes of Sculptra, it can get fairly expensive. So my recommendation for hip dips is to use your own fat. Always, always, always. I think that's the top recommendation to fill the hip dip.
Okay. Does VASER help remove scar tissue?
So it helps with fibrosis. So fibrosis is a form of scar tissue, okay? So if you have some of that more fibrous tissue, which, so we're talking here now, someone say who's had a prior liposuction, so now we're doing their second liposuction procedure, okay? It does help kind of break through some of those fibrous areas to then make it easier to then do the liposuction aspect of it afterwards. So in that sense, it does help with the scar tissue. Now, if we're talking about scar tissue, like say, for example, you had a C-section, right? And you have this deep scar and it's causing kind of that indentation there, the VASER is not really gonna help with that. For that, you typically need, either scar revision or a mini or a regular tummy tuck.
Where are you located and how many years of experience you have?
Great, so we're located in Miami, all right, pure plastic surgery here in Miami, Florida. And I have about, let's see, so many years now, all right. Yeah, so I have about 11, almost 12 years of plastic surgery experience. And here at Pure Plastic Surgery, we've been open for the past 5 years.
Okay, a few more questions. Does VASER work on leftover dog ears?
So potentially yes, because there's two reasons for dog ears. One is just excess loose skin. If that's the issue, then it's better to remove the skin. Okay, but the other is sometimes it's not just the skin, but there's like some fat left over there. Like it's like a little bulk of fat. All right, and so for that, the VASER will work great because you can do the VASER, do the liposuction, remove the bulk of fat, and not worry so much about the skin then getting loose. Because with the VASER, that skin will retract and suck back down, and it'll really beautifully take care of that dog ear.
Do you have an aftercare facility, or is that not necessary?
So we don't have an aftercare facility associated with us here at Pure. Okay, there are people that choose to go to recovery homes, but like I said, it's not part of of Pure Plastic Surgery. Now we do have a partnership with a hotel that we recommend. Okay, and we do recommend that our patients go there. But in order to go there, though, you will need a caregiver. Okay, in addition to the post-op care, and we can provide some great recommendations for the post-op care as well.
Okay, the last one for today, Doc.
All right.
Do you offer cellulite treatment?
Yes. So we're super excited about it. You've probably heard me talk about it. We do kind of announce it on Instagram and TikTok and our social media. And what we're offering is kind of revolutionary in terms of cellulite treatment. And it's called the Aveli. Okay, so the Aveli is a device that goes in and actually cuts or breaks up the bands that are causing the cellulite. So what is cellulite? Cellulite is essentially these bands, okay, that are inside that are pulling down on the skin. So it pulls the skin down, and they're basically an attachment between the skin and the underlying fascia or muscle, and it pulls the skin down in that area and it creates that dimple, okay? And so that's why if you gain weight, cellulite becomes more visible, not because it's pulling it down more, but because the fat around it is growing, right? So now that dimple seems like it's deeper, okay? But what this Aveli device does is that it goes in, it breaks up those attachments, it breaks up those fibrous septae or bands, and then allows the skin that's getting pulled in, it allows it to kind of come back up, and therefore it's now a lot smoother, getting rid of the cellulite there. All right, okay everybody, well I hope you found that super exciting. Here, one more time. There we go, VASER for you. It's the new lightsaber for plastic surgery, and I look forward to this device. I look forward to the tremendous, awesome results that it's going to give, and I look forward to catching you guys next week on Hump Day with Dr. Alex Earl.